Hello students, welcome to pharmasyndrome YouTube channel. And today our discussion is on chloramphenicol alphabet pharmacology. So if you observe our previous videos, so we're doing some crazy things like remembering of a pharmacology of drug based on its letter. So like that, today we are going to discussing pharmacology of chloramphenicol, nothing but alphabet pharmacology of chloramphenicol. So let's see here. This is the general chemical structure of the chloramphenicol. So this is the general chemical structure of chloramphenicol. If you observe here there is a nitro group, and especially this is also called as a nitrobenzene derivative. And after that, if you observe here, there is a two chiral centers in the chloramphenicol. So because of two chiral centers, there is a possibility of 4 isomers. So here our main focus on the pharmacology. So let's see the alphabet pharmacology of the chloramphenicol. And here, I hope you know alphabet pharmacology means based on its letter. So based on its letter, we will discuss the things. For example, in the chloramphenicol, the first letter is C. In the chloramphenicol, the first letter is C. So regarding C, the chloramphenicol is also called as chlormycetin, or it is also called as chlornitromycin, or it is also called as levomycetin. Okay. And next letter is H. So based on letter H, we will see. So based on letter H here, generally chloramphenicol is one of the antibiotic comes under the category of protein synthesis inhibitor, and generally it is a bacteriostatic in nature. So especially most of the protein synthesis inhibitors they are bacteriostatic in nature. But this chloramphenicol also bacteriostatic, just it stops the growth of organism but not kills. But the exception of chloramphenicol is it can kills the organisms like Haemophilus influenza, Neisseria meningitis, which cause meningitis, and Streptococcus pneumonia. So it is the exception where chloramphenicol shows bactericidal action, kills the organism. But on the remaining organisms, it shows action like bacteriostatic only. And next here, so regarding letter L, there is no information from the alphabet pharmacology. And next letter is O. So on the O, even in the GPAT or other pharmacy exams, you will get questions like follow which of the following antibiotic from the which of the source. So like that, they will ask the question. So chloramphenicol is one of the widely used antibiotic from the category of protein synthesis inhibitor. It is naturally derived from the organism Streptomyces venizellae. In the previous GPAT questions also, they directly asked chloramphenicol is naturally obtained from Streptomyces venizellae is a source of. So like that, they ask questions in the different manner. And next letter is R. In the chloramphenicol, next alphabet is R. I hope you know in the protein synthesis inhibitor, drugs like chloramphenicol, macrolides, streptogramins, these drugs binds to the 50th subunits of ribosomes and inhibit the protein synthesis. Aminoglycosides, tetracyclines binds to the 30th ribosome, and drugs binding to 50th ribosomes like chloramphenicol as well as macrolides and streptogramins. And here, based on the letter R, resistance. So especially here, microorganisms develop resistance towards chloramphenicol by affecting the acetyltransferase enzyme and also by causing mutations in the ribosomes, because ribosomes are the important target for protein synthesis inhibitors like chloramphenicol. So when there is a mutations in the ribosomes, so there will be a alteration in the mechanism of action of chloramphenicol. The chloramphenicol not effectively shows action on the microorganisms because of mutations in the ribosomes of the microorganisms. Okay. And next letter is A. The next letter is A. So regarding A, antibacterial spectrum of chloramphenicol. Antibacterial spectrum of the chloramphenicol. So here I already told you chloramphenicol is a generally bacteriostatic nature only, but it's showing bactericidal action unlike Haemophilus influenza, Neisseria meningitis, and Streptococcus pneumoniae. So generally it is a bacteriostatic nature, just stops the growth of organism, but it is a broad spectrum. So broad spectrum meaning means It can shows action on both gram-positive as well as gram-negative organisms. If it is showing only action on gram-negative or gram-positive, then it is narrow spectrum. So it is showing on both gram-positive as well as gram-negative. That's why it is called as broad-spectrum antibiotic. That is chloramphenicol. And regarding here, I just mentioned its mechanism of action. So simply, if you observe here, chloramphenicol diffuses into the bacterial cell and binds to the 50S ribosomal subunit. After binds to the 50S ribosomal subunit, what chloramphenicol is doing? It preventing the formation of peptide bond. When peptide bond is not formed, there is no protein synthesis in the microorganism, and ultimately there is a stopped growth of the bacterium, that is bacteriostatic action of the chloramphenicol. So this is a part of the nothing but a 30 to 40% part of the chloramphenicol alphabet pharmacology. And next we will go further. And next, just a second. And based on the alphabet pharmacology, the next letter is M. The next letter is M. So regarding letter M, the chloramphenicol inhibits mammalian mitochondrial protein synthesis by binding to the 70S complex. So based on the letter M, what I mentioned here, the chloramphenicol inhibits mammalian, nothing but it inhibits protein synthesis, especially mitochondrial protein synthesis in the humans by binding to the 70S complex of ribosomes. And next, the letter is P. So regarding this is very, very important for your competitive in pediatrics. So here the letter is P and the P is pediatrics. And regarding jurisprudence, P means half-life of the drugs regarding schedules. So like that, you always interrelate the subjects. When you are reading some point, you can correlate the points from different subjects. Then it will helpful for you to remember the things, and it will also very helpful to attempt easily answers to the questions in your competitive exams. Okay. And here regarding pediatrics, we have to give the suspensions or solutions in the form of sweet nature. That's why chloramphenicol palmitate in the form of sweet nature, and chloramphenicol succinate is a soluble form. Regarding solubility, chloramphenicol succinate form is preferable. And regarding sweet nature for the infants or children's, we need a sweet substance like chloramphenicol palmitate form. And in pediatrics, the chloramphenicol can cause the gray baby syndrome. So this is very, very important bit. Many times you are getting in the competitive exams routinely. So this is routine, maybe in your statewide pharmacist exams, maybe drug inspector exams, maybe NIPER exam, maybe GPAT exam, you will get the question simply, gray baby syndrome is caused by, that is chloramphenicol. And you know, chloramphenicol is a protein synthesis inhibitor, and it binds to the 50S ribosomal subunits. So gray baby syndrome. So what is gray baby syndrome? If you observe the picture here, just I mentioned for your interest and easily remembering purpose. So generally, chloramphenicol, if you took in the infants as well as children around 5 years, like that, what will happen? In that infants or children, the liver enzymatic system is not well developed. And especially phase 2 metabolism, glucuronidation is not well developed. Due to not well developed liver enzymatic metabolism, the drug not metabolized easily, and it is stay inside the body only. So because of that, increasing chloramphenicol concentration in the body, it changes the skin color and can cause the gray baby syndrome. So that is the reason chloramphenicol can cause the gray baby syndrome due to immature metabolism, especially phase 2 metabolism of glucuronidation, and not proper levels of CYP enzymes, that is liver metabolic enzymes. Okay. And next, letter is H. So based on letter H again, this chloramphenicol can cause the hypotension, low BP, and can reduce the body temperature. So here I put a small image for our understanding purpose. So lower the temperature, we will feel cold. So decrease the blood pressure as well as decreases body temperature. And next letter is E. The next letter is E. That is alphabet E. And the chloramphenicol is widely used in the eye as well as ear infections. Eye as well as ear infections, chloramphenicol is useful. Next, the letter is nitrogen. The alphabet is nitrogen. And here important is nitro group. I already showed to you at the start of this video. the chloramphenicol is contains a nitro group. Especially the nitro group easily penetrates the bone marrow and causes suppression or depression of bone marrow. When bone marrow is suppressed, there is a decreased production of RBC, WBC as well as plate cells. You have to remember, chloramphenicol causes gray baby syndrome due to immature metabolism in the infants as well as children, and it also called bone marrow suppression because of its nitro group directly penetrates into the bone marrow and suppress or depress the function of bone marrow, and it decreased release of WBC, RBC as well as platelets. And next alphabet is I. So based on alphabet I, chloramphenicol inhibit the CYP liver enzymes, that is cytochrome P450 metabolic liver enzymes like CYP1A2, CYP3A4. So number of enzymes are there. So if you observe in the metabolism concept in the general pharmacology, there is an enzyme inducers which increase the CYP enzyme levels, enzyme inhibitor which decreases CYP enzyme levels. And here chloramphenicol is a CYP enzyme inhibitor, inhibit the liver CYP enzymes, decrease the liver CYP enzymes. And the next alphabet is C. So based on C here, the chloramphenicol is contraindicated in the lactating mothers. The chloramphenicol is contraindicated in the pregnant women. The chloramphenicol is contraindicated in the infants and also children. So during these persons, not during. So in this person, chloramphenicol is contraindicated. It should not be taken by these persons like lactating mothers, like pregnant women, like infants as well as children. And next we are moving to the next slide. And here we are coming to the closing. So next alphabet is O. The next alphabet is O. So based on O here, so toxic reactions like fatalities. Fatality means danger. It may cause the death. Have occurred in the premature as well as newborn. If you take or if you took the chloramphenicol to the pregnant woman or you took the chloramphenicol in the newborn, definitely it will cause a danger. And here letter O and here also letter O. So based on that, I give the information regarding letter O. And the last alphabet is in the chloramphenicol is L. So simply last but not least. So what is that last but not least? Here it is topically used as a eye. So in the eye, it can be topical used formulation on the eye and as a ear drops and as an ointment. And other than that, it can also use the parental route like intravenous injection or infusion, or it can be taken as a oral capsules, So this is the alphabet pharmacology of chloramphenicol. I hope like this study is make easy for you to remember the pharmacology points easily. And please follow our videos regarding previous videos also, and subscribe to our channel, like, share to your friends also, and give your valuable feedback. And I hope if you are seeing here, there is a this is pharmasyndrome online platform. Here we are providing a GPAT, NIPER, and coaching for other even like pharmacist exams like drug inspector, and even we are giving tutorials for individual subject like medicinal chemistry, like pharmacology, like biochemistry, whatever your interest. If you are really looking forward, you can contact us. And especially within soon we are going to start our GPAT 2023 coaching. So if you are BPharm 4th years, please share to your third year as well as second year students, and as well as share to other college students also, definitely who are in your contact list. Okay. Anyway, once again, subscribe, like, share, comment, and follow our channel for daily updates. Thank you.